From Baldwin to Bieber, Hailey's journey has been star-studded and full of surprises. Surgery speculations have been swirling, myth or reality. Dive in with us, and by the end, we'll discuss the secrets behind Hailey Bieber's captivating looks. Just a reminder that this information is purely speculative and is meant to educate the public about plastic surgery in general. In 2013, at the age of 16, what I see is that Hailey has a low hairline. The upper third of her face is shorter than the middle third and the lower third of her face. Her eyebrow peaks around the level of the lateral limbus. Most commonly, the peak of the eyebrow is between the lateral canthus and the lateral limbus of the eye. It usually falls somewhere within that range. So what I see here is that her eyebrow peak is falling right at the lateral limbus. Hailey has strong bony structures to her face, and that includes the maxilla, which is part of what makes up the midface, and the mandible, or the lower jaw. I'm also seeing some facial asymmetry, which we all have. The right side of her face is lower than the left, and you can really see this at the level of the eyes as well as the chin. We actually have a video on facial asymmetry, so make sure to check that one out. She also has slight nasal tip bulbosity, which is where the lower lateral cartilages have a rounded appearance to them, and that's what gives the bulbous look. She has full lips with a relatively flat upper vermilion border. So when you look at the shape of the upper lip and you trace the vermilion, there's some relative flatness to that configuration. Some people have more arching to their upper lip, and some people have a flatter configuration. Also, when I compare back to her photos from 2011, she does have some signs of a possible brow lift, with or without an upper blepharoplasty. Her eyes just appear more open. There's now more supratarsal show, which is that platform on our upper eyelid where makeup usually goes. Her upper eyelids have less of a hooded appearance now. Generally, cosmetic procedures aren't done on patients under the age of 18, but there are some notable exceptions, especially in a rhinoplasty surgery. Sometimes when patients have a nose that really stands out and that they really want corrected, some patients can be as young as 15, 16, 17 years old when they end up getting their first rhinoplasty. Now, of course, this appearance can also be the result of just new makeup, for example, or maybe the effect of Botox, but I do think that that's less likely in this scenario. In 2015, at the age of 18, Hailey has a natural configuration to her lateral canthus. It appears to be higher than the medial canthus, and this is a youthful type of orientation. There is a functional relevance here in that tears have to flow from the lacrimal gland, which is out more laterally, down towards the nose. And so having a slight cant to your eyelid where the lateral canthus is higher than medial canthus will actually guide the tears in the proper direction. She also has excellent supratarsal show, and this is related to what we discussed about Hailey in 2013. When I look at these photos, I see some signs of a possible rhinoplasty procedure. The nasal tip appears more defined and less bulbous compared to prior. The slight dorsal hump that she previously had, to me, is still preserved. There's also a bit more rotation to the nasal tip. As our nasal tip rotates, meaning it starts to swing up, the nostrils typically become more visible from both the frontal view and the profile view or the side view, and this is called nostril show. In 2016, at the age of 19, what I see are some signs of possible lip filler, especially when you look at the upper lip. The lateral elements appear to be more full. It almost looks like they purposefully skipped the central portion to enhance the lateral aspects of the upper lip. And there's slight settling of the filler outside of the vermilion border. So there has been some migration that has occurred. Migration occurs almost inevitably when you do lip filler, even in the best of hands. It occurs even more when you try to enhance the vermilion border itself. Some of that filler will spill out into the cutaneous upper lip and into the cutaneous lower lip if you're injecting filler into the lower lip as well. But when people go to dissolve lip filler, they often focus on what's just in the red lips. They frequently forget to put that dissolving material, which is hyaluronidase, into the cutaneous portions of the lip, so they really don't get all of the filler out. And we actually have a video on lip filler dissolving, so check that out if you're interested. In 2018, at the age of 21, what I see here is that Hailey has great infrabrow fullness. And this, of course, looks quite youthful. She also has great long eyelashes, and that's something that I don't talk about too frequently on the channel, but that really does add to the aesthetic of that whole periorbital area. And because most procedures on the face are actually meant to enhance the appearance of the eyes, including a rhinoplasty, which is meant to take attention away from the nose and put it onto the eyes. So now when you're looking at the eyes, when you see long full eyelashes, that of course adds to someone's aesthetic appearance. And we've actually formulated a really nice eyelash and eyebrow serum, and we'll be releasing that sometime in 2024. Head to feelconfident.com and sign up for the newsletter. In 2019, at the age of 22, it looks like Hailey is starting to shorten the tail of her eyebrows. And the purpose is to have more of a lifted brow appearance by removing the lateral portion of the eyebrow, or what's called the tail of the eyebrow. You can apply makeup or microblading to make the tail appear higher. And we have a video on eyebrow shaving that we recently published, so make sure to check that out. In 2020, at the age of 23, Hailey has, again, upper lip filler migration. Now, some people might look at the photos and wonder, maybe this is her natural lip roll. We all have a natural lip roll in our youth, and this is like a three-dimensional hill-like structure where the cutaneous lip becomes the red lip. And some people try to recreate that structure with lip filler. In 2021, at the age of 24, what I see here is that Hailey has a difference in her nostril sizes. The left nostril opening is bigger than the right. And to my eye, it wasn't exactly like this in her youth. So perhaps this is just a result of natural aging, which of course is possible, or it might be because of a potential prior rhinoplasty. As we look to sculpt the tip of the nose, and we remove some cartilage to do that, it can actually weaken the nose. And as the nose gets weaker, it can shift. And so over time, even if it doesn't happen right away, you could get this shifting that occurs. Rhinoplasty results are really not as permanent as people think they are. Our nose continues to change along with the rest of our face and our bodies as we age. The skin of the nose in particular gets longer and bigger. The cartilage in our nose and some of the other supporting structures start to weaken over time. In 2022, at the age of 25, the tail of her eyebrow is actually back. The arch has now moved more laterally, so now it's closer to her lateral canthus, and this helps enhance her heart-shaped face. In 2023, at the age of 26, I am seeing some signs of cheek filler. She's always had a prominent cheek. The actual bony structure is quite strong, but now it appears more enhanced to me. There's a fullness there along her cheek from medial to lateral that looks more pronounced than her appearance prior. The total cost of her potential procedures is $70,000. I think there should be less shame associated with people getting plastic surgery or any other related procedures. I think people who decide to get plastic surgery procedures should do so safely and proudly. Hailey looks great whether she had plastic surgery or not.